one of the YouTube show that helped me to learn about different medicines and stuff like that was Lewy Body Association, and Professor Ian McKee. I listened to him, and he was one who told me about the different kind, like Seroquel. Like, even if you look Seroquel up, it's a black box around it when it comes for the dementia patient, and that means death. So that's why you need to get power of attorney, look up certain medication. Oh, and this other experience I had, I took him to the doctor, and they thought he had a urinary tract infection, so they gave me some antibiotics. Okay, so the antibiotics evidently he had a kind of allergic reaction to it because his lips swelled up real bad. So I took him to the ER room. So I took him to the ER, and this was during COVID time, and he got really wild in there, really acting real agitated, real just moving. He was moving so bad that the little girl couldn't even take his blood pressure. And his eyes, like he wasn't even there. He was just doing all this moving. And so I asked the intern, I said, what did you give him? He said, I gave him Benadryl. And that's usually what they give you if they think you having some, if you're allergic to something or whatever, to kind of, they give you Benadryl. So I said, don't you know that you don't give dementia patients Benadryl? And and then he said that he looked it up, what I said, and the other nurse was in there. He looked it up, and he didn't say anything because I knew, she knew, and but he was acting so wild that he went and told when he went and told the other doctor that he was working under. He said that he wanted to admit it. And I said, well, no, I don't want him admitted because this was during COVID time. But that was just maybe one of the reasons I didn't want him admitted. But the other reason why I didn't want him admitted because he walks, he's a wanderer, and they wouldn't know how to take care of him. And plus, he would be roaming around the hospital, getting in other people's stuff, getting in other people's rooms, and they would be having a hard time trying to control him. And then if they like pushed him or shoved him or tried to make him do something, he's weighing 220 at this time. So he not gonna let them do that to him. He will fight them and stuff like that. And then they'll be saying he got behavior problems. But no, he don't really have a behavior problem. He has don't want you push him around. Don't want you doing stuff to him that he don't think is right because he don't feel like he's doing anything wrong. So you got to be vigilant. That's why I say you have to get that power of attorney so you can make certain decisions, and you have to learn stuff that you have to do. That's one way to protect him and yourself, because you have to learn how to protect you too. Because if they send them to some kind of another hospital or something like that, well, they don't know how to take care of them either. So that makes you more frustrated and all that. So you have to, like I say, you have to protect your mental health the best way you can. And that's like making decisions, getting knowledge about the disease and how it's going to progress. And another thing that happened is, so back to, so they didn't want to release him. And so the doctor said they released him if they wind up taking his blood pressure. So, I mean, it took the girl about 2 hours just to take his blood pressure. So she finally got it, and we finally was dismissed. But I sit there during that time because I knew that it wasn't going to be good if they took him up on that floor. And that's the same thing with nursing homes. They don't have time to give him one-on-one care or care the time to give him the care that he needs. Because I work in a nursing home, and I know this. I mean, it might be some out there that can, or they setting up facilities that do be able to do that. But at the ones that around in the area like that you go to, they don't really know how to do that. And I know that him in a nursing home setting, he wouldn't be a good candidate because the reason why, because like I said, he's a wonder. He'll walk in other people's room, he'll mess with their stuff, and then if and he, like I said, he's not gonna let nobody hit him or nothing. And so if one of those other patients hit him, he gonna hit him back, and he gonna fight him or and that's not a good scene that I know, and I already know that this how he is, this is what happens, so I'm going to avoid that at all costs. But like I said, I'm not saying don't put your loved ones in nursing home, because this might be some nursing home out there that's able to handle that situation, but you need to talk to them, make sure they know how to deal with that situation. Because if you don't, they're gonna take you down another road that you're gonna be even more frustrated than you already are. Because he gonna be in are you gonna send him to some kind of institution or something like that? Because they really don't know how to take care of those kind of people. Okay, so that's one reason I'm trying to make this video, so maybe I can help somebody. I'm not gonna get it right all the time, but I'm gonna tell you what helped me. Okay, and so I just kept him at home, and so after he was dismissed from the hospital, he came home, sit down, he was okay. And that's why I say you have to be able to educate yourself and know what's going on with disease, and halfway try to think for yourself and analyze what people are saying on the internet, because it's like they are saying, like on the internet, like when you when you walk up behind, when they see stuff, they see other people and stuff. Like he would say to me, like it's somebody. I was sitting on the couch, he was sitting on the couch, and he said, who is that over there? I said, they're not real. And he said, they're not real. I said, they're not real. He said, you mean like a ghost? I said, no. I said, more like a mirage. And I said, touch me. And he touched my arm. And then I said, touch them. I said, touch them. So he touched them, and they weren't there. So I know sometime when he was going through that, he would reach out and he wouldn't touch nobody, but I know he was reaching for somebody. But it still stayed with him that they wasn't there. And so that made a lot of stuff better. And so if they saying stuff to him and stuff, or he dismissed them before he gets to that point where he's listening to them, or they saying stuff to him, that's what I was trying to orient him back to reality. But like, they're not gonna come all the way back to reality. Sometimes you can, and sometimes you can't. But like the behavior thing, like I say, you have to leave them alone when they upset, when they are you think they might want to fight. You got to be aware of what they're going through, and it's not only going to help them, it's going to help you.